Welcome to Live with Hillsdale Hospital. Today is Thursday, June 27th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community and around the state for today. I'm Communications Officer, and I am joined remotely and virtually by
JJ Hodshire, President and Chief Executive Officer. Rachel, it's great to be with you. Usually I'm in the studio. Even though we've done these remotely, you are usually with me, but it's great to be able to see you as we are at the Michigan Hospital Association's annual meeting in which we discuss all the state of affairs as it relates to healthcare in the state of Michigan, in the work that we do as board members. And I'm going to introduce another board member of MHA in the work that we do to advance hospitals. And it's not just about rural hospitals, even though that's where our passion is. But it's also about advancing healthcare in the state of Michigan. So it's great to join you. And I am joined by one of my dearest friends, a close colleague that I have gotten to know here over the last several years. Just really, a consultant said to me 2 weeks ago, "Is Karen Cheeseman really that nice?" And I said, that's her. I said, she is the real deal. And so it's my pleasure to introduce my good friend, President, CEO, Karen Cheeseman. And Karen is with the Mackinac Straits Health System, which I'm going to let her. Karen, you want to talk to us a little bit briefly about where Mackinac Straits is, what kind of system you are?
Yes. Well, thank you, JJ and Rachel, for having me this afternoon. It's a real pleasure to be with both of you and have the opportunity to share some of the current updates in rural health. Mackinac Straits is located in the eastern Upper Peninsula. So we're the first community as you enter Michigan's Upper Peninsula. We're in a beautiful area surrounded by we have two of the Great Lakes here, which is really unique.
Very
So
unique.
we have Lake Michigan and Lake Huron, and a lot of natural beauty that we enjoy here in the eastern Upper Peninsula.
And very unique because, Karen, you're a situation where your population kind of swells at times, right?
It sure does. It sure does. In fact, with tourism being our primary um, driver of the economy here in northern Michigan. We swell. We have about 1.2 million visitors that visit the Straits area in just a very short 6-month period.
It's unreal.
Wow.
And so obviously opportunities are plentiful to take care of snowmobilers who get injured, to water skiing folks that have injuries, and you're serving that population very well. And you're a critical access hospital, and you want to talk a little bit about what that means for your community.
Yes, absolutely. We are, as mentioned, we have a 15-bed hospital of critical access status. We have a number of designated rural health clinics. St. Ignace itself has a population of about 2,700 residents, and then we also serve a larger population within the county of Mackinac. We're drawing from a population of just under 11,000. With the specialty care that we've added in recent years, we also have a reach that extends beyond the eastern Upper Peninsula, so serving the northern lower as well, and really stretching in excess of 100 miles both to the north and the south.
Yeah. So before Rachel gets into some of the meat of our discussion today about, what's working well, what's not, what keeps you up at night, really want to, we're here at the conference. It's a lot of work sessions. And I guess what's the value added in your mind about an event in a partnership with MHA?
No question. The value is for me. It's really about the relationships and the partnerships that we form and the passion that we share to advocate for the health of our communities, and the power in the passion when you bring folks collectively together who have the ability to do that. And really have the heart and passion for that type of work.
Yeah, it's really great to see, and great speakers, great opportunities. But the work that the MHA is doing, and I'd be remiss, and so would you, if we didn't certainly compliment the work of an amazing team. Michigan Hospital Association is led by Brian Peters, consummate professional, great leader, and their team Karen, you've been on the board longer than I have and been involved longer than me, but I think this is a phenomenal group, and we've had some wins.
We absolutely have. And JJ, you're right. This is an outstanding team. This type of work of this magnitude, can't be done by one or two individuals alone. So really, we have the privilege of working with such talented individuals,
Amazingly talented,
who promote the
Yeah.
work that we do throughout
Yeah.
the entire state.
Yeah, it's wonderful. Rachel, back to you in the studio. Why don't you go ahead and I know you've got some questions that you're going to rapid fire
I
Karen here, so go
do.
right ahead.
I do. So, Karen, let's start with no pressure, but what's your biggest challenge right now? And how does that challenge relate to the state of rural healthcare today, both in your community, in the state of Michigan, and I guess also around the country?
Sure. So we, not unique to rural healthcare. We face different challenges, all throughout the year in the work that we do. We actually are in a unique position right now where we are facing unique growth challenges. And I have always said that I welcome growth problems. They're the absolute best type of challenges
Mhm.
that you can have in healthcare today. And so when I talk about growth, it's really what are we doing to promote the access to care in our community, and how do we accommodate the space, the resources, etc., necessary to do that and to do it well to meet the community's needs.
And you guys have a pretty big infrastructure project going on right now, is that right?
We
I
sure
think you
do.
hadn't quite launched it last year at this time
They hadn't.
when we were talking both here on our live, and also we did a podcast episode with you about a year ago, and you I think had maybe just announced it, but now you're in the thick of it, right?
It's exciting.
We sure are. We sure are. Absolutely. So, a great segue regarding the growth. To address that, we have constructed a 26,000 square foot medical office building. And so we are preparing to take occupancy actually in early August. So we're winding
Nice.
down the project and are really excited to be able to share that additional space and welcome the community in for the additional care that will be provided in those areas.
Karen, let's talk a little bit about rural healthcare in general. And, if you were to create a roadmap, and in that roadmap, you could cast a vision for what rural healthcare should look like, and we're faced with tremendous amount of challenges, just with payments and reimbursements and making a margin to have a mission. But in your mind and in your vision, what would that look like? And I guess second part of that is for you, what's it going to look like in the future for Upper Michigan and in your mind, Michigan in general?
Sure. Certainly. So as we all know, the landscape continues to change in healthcare and continues to evolve at a very rapid pace. And so I think it's really important to take a look at our environment and look at all of the things that are changing in terms of additional mergers and
Yeah,
acquisitions,
it's a big one.
etc.
Mhm.
And so I think we have to be very realistic about the independence that we enjoy in our current communities, the ability to make decisions locally and provide care as we know is best for our respective communities. And so, as I look out, we have a lot of conversations with our leadership team and our board of trustees, et cetera. And at the end of the day, we want to ensure that we're providing the very best care to our community, and we're meeting those needs. And that there's so many things that that come along with that we have to be continually working at. And we know that reimbursement is absolutely top of mind,
Sure
so
is.
that we have appropriate reimbursement
Yeah.
for all aspects of our population and our payers that we partner with to deliver care. There's the cybersecurity
It's huge.
piece is very big, right? It's difficult today to to read any type of newsprint or turn on the news and not hear about another unfortunate cyber attack of some type.
And I think, Karen, it's the message you're hearing and I'm hearing this week is it's not if, it's when. Because we're all going to be a victim of it. Not too long ago, Rachel, as you know, Ascension was hit hard, and it blocked the admissions from my ER, because that's where some of our patients go, blocked admissions from our ER up to that hospital as a tertiary center for us. It not only has implications financially for a hospital, but also for the care of patients and their families.
Right.
And that is a major concern. So learning about that, I think, has been important too for us.
Absolutely, and I think we have to recognize that the rural sites may at times be vulnerable, a little more vulnerable than some of the larger systems who have perhaps greater resources to combat some of this criminal activity that's taking place in the cyberspace now. So I think that's got to remain top of mind for all of us. We all continue to work tirelessly to ensure that we have adequate resources to deliver care in our communities. So job retention and recruitment, pipeline efforts, all of those things are really mission critical for us. And then all of that combined requires a lot of great partnerships for advocacy to make sure that our voice is heard, so that we're partnering with all of our different folks, whether that be in Lansing, whether that be in our own backyard with our legislative partners and representatives, to make sure that we share that message and we continue to work on health policy for delivery.
And Karen's done a great job at really advocating not only for her system, but for healthcare in general in the state. And such advocacy has actually resulted in an earmark that she received last year before last, in which she was able to accomplish some of her goals in her building project. And that is very difficult, as you know, Rachel, to convince the legislature or certain members of the legislature of why you need something over someone else. And so something, of that magnitude is really reflective of the leadership that Karen Cheeseman has brought and continues to bring to the system and into the voice of rural healthcare across Michigan, but also having been on our podcast, the message that she gave America about, how to save rural healthcare, and it's collaboration, it's working together. It's what I said, the consultant said about her, just a kind human being who wants to see patients do well. I'm going to follow up with one before I turn it back over to you, Rachel. We talk about all the things that are happening, but Karen, what's keeping you up at night when you think about what we're dealing with in healthcare?
I think as a healthcare professional, we always have to be prepared of constant change. And as stated earlier, our environment is changing so rapidly, right? It's so when I think about that, and I really think how do my team and I and the board stay abreast of all of the change, and really make sure we're very diligent in prioritizing the issues that are most impactful. And that means juggling a number of things, right, at any given time. And I touched on, some of those current things in some of our conversation earlier, right? And so when we think about workforce and cybersecurity, currently, right, we're very mindful and of nurse staffing ratios, things of that nature. So
could you talk a little bit about that? Because there may be some folks listening today, Karen, who don't understand what that means and what the implications are. Could you just give us a brief, and I know we don't have much time with you, but could you give a brief overview of what that is?
Certainly. So throughout the last year, there has been a real push for what we refer to as mandated nurse staffing ratios, meaning in short order that the mandate would come down legislatively, and it would direct all hospitals as to how nursing ratios were provided without consideration for all of the different variables that we encounter in our hospital on any given day, ranging from acuity needs to a whole host of other things that come into play. And each hospital is different, and each hospital has its own unique set of circumstances. So we have worked really hard to share our message, to share our story about the importance of hospitals continuing to be sure that we do what we do best and work with our nursing leaders and a number of other various leaders to make sure that they retain direct control of the staffing ratios.
Absolutely.
As they've done successfully for many years.
Yeah.
Recognizing it's not a one size fits all model.
No.
So that remains really important, and I think it's really important to understand, should that go into effect, there are so many other downstream implications for all hospitals.
Yeah, huge implications for us, and we say, let healthcare take care of itself. The involvement of certain mandates such as staffing ratios. It's not a one size fits all, and what we do at Hillsdale is much different even than what Karen does at Mackinac Straits. And so vice versa, what happens in the big system. So a lot of things that we're fighting here at our meeting and talking about. And when I say fighting, I mean we're fighting the good fight of making sure we can keep our hospitals sustained into the future.
Right.
That's looking at payers. That's looking at providers. That's looking at recruitment, retention. Thousands of open jobs still in the state of Michigan for nursing. And for other modalities, other services, other professionals. And so we're all in this together. It's great to get the team here. Karen, it's been an absolute pleasure to spend a few days here at the conference with you, and I look forward to our continued service on the MHA board, as well as being colleagues of rural hospitals as we're taking care of the most needy in our community. So thanks for the work you do.
Well, likewise. Thank you, JJ. And it's certainly important to continue our rural connection and
That's right.
Collaborate together for the greater good of rural healthcare.
That's right. Rachel, back to you in the studio.
Yeah, as we wrap up, Karen, I just want to give you a quick opportunity because, people see the hospital CEOs and think about, oh, these hospital CEOs are all together meeting. You guys have just talked about why this is important, but I also want to give you the opportunity to just, Karen, to give a shameless plug for your hospital and for your team. Tell us how great they are and why.
Yes, and thanks for that opportunity, Rachel. Absolutely. It's as stated earlier, this healthcare is hard work. It takes a tremendous amount of grit and tenacity to do what our teams do every day. And I feel really privileged to have a team behind me that shares that common goal and passion to really work incredibly hard to continue to ensure that we have great healthcare in the Straits area. And so, again, nobody can go at this alone. And so I think it's really important to always make sure that the work our individual teams, our respective teams are doing is recognized appropriately. So I'm thankful. Couldn't do what we do without them.
We couldn't.
That is great. All right. Well, as we close today, we do want to thank you, our community here in Hillsdale, and of course, Karen's community up there in the Straits for your continued support. To nominate a hospital staff member here at Hillsdale for our quarterly patient care award based on the experience you or your family member had, visit hillsdalehospital.com/award. To support our capital fundraising campaign, visit hillsdalehospital.com/campaign. And to learn about volunteering at Hillsdale Hospital, visit hillsdalehospital.com/ you guessed it, volunteer. And if you want to join an award-winning workplace in the healthcare industry, check out hillsdalehospital.com/careers. Catch us on WCSR on Fridays for more discussions like this. Don't forget to check out our national podcast, Rural Health Rising, at ruralhealthrising.com, or subscribe wherever you get your podcasts. We will see you here again soon. And until then, stay safe, stay healthy, stay Hillsdale strong, and choose Hillsdale first.
Thank you, Rachel.
Thanks, Rachel.